and thanks for joining us. My name is Stephen Perlin, as always, and we are here today in Owego at the newest physical therapy location. We're very excited to be here. We're located at, I think it's 941 State Route 17C, as I said, in Owego. And right with me is the manager and physical therapist here, Kelly Buckbaum.
Yes.
Thank you for joining us today, Kelly.
Thank you for having me.
So tell us a little bit about this facility. It's very exciting that it's here. What do we do here, and what can we do for people?
So we are opening this satellite clinic to kind of open up some closer facility for our patients. And we have physical therapists, physical therapy assistants, and we have a sports performance program here as well. And we treat all ages, all conditions, orthopedically based.
So people are coming in here, they might have had a surgery, there just might be some sort of injury. It's really a whole myriad of different things going on here.
Yeah, we treat, kind of any kind of movement impairments, functionally based. People are having a hard time kind of with their daily activities. Obviously if people have had surgeries, we rehab that and get them back to what they want to do, their goals, kind of activities of daily living, function, work, all of those kinds of things, sports for, our younger athletes and patients.
And it's definitely, I'm sure, convenient to people who aren't as close to our big center in Vestal and everything like that. We have all the same amenities here, beautiful facility, and lucky for you guys, we're going to show you that. So we're going to start doing a little bit of walking here, and so you can see the facility a little bit more. So on our left, what do we have going on here?
So this is most of our equipment. We do a lot of cardiovascular work with our patients. Getting them back to a healthy lifestyle, helps with range of motion, any kind of strengthening. So we do have an elliptical here. We have a shuttle leg press. We do have a treadmill. And then we were going to show what the new step is. It's a favorite of a lot of our patients, so we thought we would want to show that.
Yep.
Luke here is going to show it. Luke is one of our physical therapy assistants.
Thanks for doing this for us today, Luke.
Absolutely.
So we put patients of all ages on this, but most people really love this exercise. So really it works arms and legs at the same time. You can get a little bit of core working as well as some range of motion and just general cardiovascular exercise on this machine. And you can see it's pretty easy, but people can get a good workout at the same time, so not so taxing.
This type of machine, this works for almost everything you see that comes in here.
Yeah,
I mean, you can really work it in any sort of way.
Yeah, we really could. So, some people have a hard time on a bike getting all the way around in range of motion for a knee, so this is really nice. Not a lot of compression on joints in a machine like this. So it's a nicer way to get some of that cardiovascular exercise that people look for without a lot of the joint compression.
Yeah, it obviously helps, as you're developing strength tech in those core areas as well.
Absolutely, yep.
Okay, very cool. Thank you, Luke. And we're going to keep moving here.
So we also have
more equipment behind us.
Yeah, we also have an arm bike. So for people that may be non-weight bearing after a surgery for their leg, or we may be working some upper body muscles, this is a really nice option for people and to get some more of that cardio. And then we just have a regular recumbent bike that is another favorite for people. So that's a really great one.
And that's just like regular for your legs and everything like that.
Yep, we use it a lot for range of motion for people who've had a total knee replacement.
Okay.
They utilize this a lot.
And now we're moving over here kind of to our sports performance area, if I'm correct?
Yep.
And, a lot of weights that are probably too heavy for me, and a lot of balls maybe that I can't lift exactly. But I think Luke's going to pop back in here and he's going to show us another thing. This is, you guys had a good name for it.
Yeah, so we call these the battle ropes. So this would be a higher level exercise for some of our athletes or stronger individuals that are getting back to heavier work activities or heavier leisure activities. But Luke's working literally every muscle in his body with this exercise.
Now, Luke, you just bend a specific way. Is that a big part of it? Is that
there's a lot of different things you can do with this. So generally you have people in a squatted position, so that way you're also working in the legs a little bit, trying to hold that position, as well as your core stabilizing through these shoulder movements. And there's all different directions you can do, up and down, side to side, roll rotating.
So this works more as an upper body workout, or does it do stuff with your legs
Generally,
too? Because you
yes,
got the-
but yes, you can. I mean, you can do all sorts of things. You can do, one leg balancing. You can throw in, if you're really advanced, you can throw in like the Dynadisc or the Bosu ball,
Oh, okay.
standing on that. But yeah, this one kind of works everything: upper body, core, lower body, all of it.
Yeah, I'm definitely getting tired from watching it, that's for sure. And then as you see behind us, there's some more weights, obviously, especially in sports performance. There's a lot about working out and getting that strength back after any sort of injury.
Yeah, we're really excited about this space. There's a lot of opportunities for this where, can bring some groups in from the community that we're kind of excited to offer. We have athletic trainers and strength and conditioning coaches that will be in and out of here and working in this space with patients and clients, along with us working with our patients. So it's really exciting to have a space like this to offer to not only our patients, but to the community to come in and work in groups and just get better at what they're doing.
Yeah, it's got to be great for local athletes who might have had trouble getting to Vestal or somewhere that's a little bit further away.
Yeah.
Backyard where they can come and get that same workout or that same rehabilitation that they might need.
Absolutely. I'm very excited about that piece.
Awesome.
Yeah.
So stay tuned for more information on that. We're going to walk over here. We have some exam rooms, right? Am I correct about saying that?
Yeah, so we have 2 private treatment rooms. This is typically where we would do an initial evaluation. We would also do treatments where people need a little bit more kind of seclusion and quiet space. We treat concussions, we treat people with vestibular issues, and sometimes all the activity out in the gym is a little much, so bringing them in a room like this is nice to have.
Yeah, I can imagine the privacy for some people, they might be uncomfortable with what they're working out or how they're working it out, so this will be good in here.
Yeah, so we've got some nice equipment for sure in these rooms too.
Then now you see the private beds, we also have some of the more open ones. And now, what these are out here, is this just more of the stretching area type of stuff, or is like less physical work done on these?
Yeah, so actually we do a lot of mat activity, just really teaching patients corrective exercises, proper breathing technique, proper muscle activation. Before anybody can do an exercise like Luke was just doing, they need to know how to activate the muscles all used in that activity. And so that takes a lot of work on the tables. A lot of our manual work is done there, so we do a lot of stretching, we do a lot of joint mobilizations, soft tissue mobilizations, lots of different things that we do with the patients on the tables as well. So there is a lot that goes on over here, but we don't want people here too much. We want them up and active, so there's a good transition of table work to functional work up and about. So we like to mix it up a little bit.
That's good. Yeah, I'm sure it gets everything working, which is obviously the idea here, so everything's getting back to 100%.
Absolutely.
Great. Well, I think that's pretty much the long and short of this place. Obviously, this great tour. I mean, it's a fantastic facility. I mean, people should come and check it out for themselves. You can get more information about the facility on nyuhs.org, or you can give us a call right here at 972-2990. Thank you, everybody, for joining us, and thank you, Kelly, for taking the time to give us this great tour.
Thank you very much. I appreciate it.
Yep, and we will see you guys soon. Have a good one.